Right now, if you broke your arm, you know exactly what would happen. An ambulance, an x-ray, a doctor setting the bone under anesthesia, a cast, 6 weeks of healing, done. You'd barely think about it as a crisis. But for almost all of human history, a broken bone wasn't an inconvenience. It was one of the most dangerous things that could happen to you. No x-ray to see how bad it was, no anesthesia for the pain of setting it, no antibiotics if the skin broke open and infection set in. A broken leg in the wild didn't just hurt. It could mean you couldn't run, couldn't hunt, couldn't outrun a predator, and couldn't keep up with a group that had to keep moving to survive. By every rule of natural selection, a badly broken bone should have been a death sentence. And yet, when scientists dig up ancient skeletons, over and over again, they find something that shouldn't be there: healed fractures, bones that were shattered and then mended. Which means someone, somewhere, tens of thousands of years before medicine existed, was already keeping badly injured people alive. So the real question isn't just how bones healed, it's who made sure the person survived long enough for that healing to happen.
Let's go back further than you'd expect. In Shanidar Cave, in what is now northern Iraq, archaeologists uncovered the skeleton of a Neanderthal man now known as Shanidar I. He lived somewhere between 45,000 and 70,000 years ago, and his bones tell a brutal story. At some point, probably as a young man, he took a violent blow to the side of his face. It likely blinded him in one eye. It also seems to have damaged the part of his brain controlling movement, because his right arm was withered and weak for the rest of his life, and his lower arm was eventually amputated, possibly deliberately at the elbow. He had a healed fracture in his foot that would have left him with a permanent limp, and bony growths in his ear canals suggest he was profoundly deaf. Blind in one eye, missing part of an arm, a bad limp, partially deaf. In a world of predators and cold and constant physical labor, that combination should have killed him fast. Instead, he lived to be somewhere between 35 and 50 years old, which for a Neanderthal was old age. He could not have hunted effectively. He could not have defended himself well. He almost certainly survived because the people around him fed him, protected him, and helped him move for years with nothing to gain from it except keeping him alive. That's not an accident of healing. That's care. And Shanidar I isn't the only Neanderthal like this. Across multiple sites, researchers have documented a pattern of healed trauma so consistent that some scientists jokingly refer to it as the Neanderthal life, because so many individuals show old, healed injuries, breaks, fractures that mended crookedly but mended. Neanderthals were getting seriously hurt on a regular basis, probably from hunting large animals at close range with handheld weapons, and a striking number of them were surviving it. Not because Neanderthal bones were magic, because someone kept them alive while the bone did what bones do naturally, which is slowly knit itself back together, whether or not anyone helps.
That's actually the strange secret at the center of this whole topic. Bone doesn't need medicine to heal. It needs time, and it needs the person to survive long enough to give it that time. Every bone in your body is constantly being broken down and rebuilt by specialized cells, even when nothing is wrong. When a bone actually fractures, that same rebuilding process kicks into overdrive. Blood clots at the break. Then a soft collar of new tissue forms around the fracture, called a callus. Over weeks, that callus hardens into bone. Over months, your body slowly reshapes it back toward its original form. This process worked exactly the same way 100,000 years ago as it does today. The problem was never the biology. The problem was staying alive during it. Which is why the real turning point in this story isn't a medical breakthrough, it's proof that ancient people understood the injured needed protecting. In a cave in northern Israel, archaeologists found the remains of a young adult with a fracture in the small bones of the foot, an injury that in the wild is nearly a death sentence, because you cannot walk, and if you cannot walk, you cannot keep up. But this fracture had healed remarkably well, in near-perfect alignment. Researchers studying the bone concluded the person could not possibly have continued walking, hunting, or foraging on their own during that recovery. Somebody brought them food. Somebody protected them from danger. Somebody essentially nursed them back to health, tens of thousands of years before the word nurse existed. Then there's a discovery that pushes this even further than anyone expected. In a cave called Liang Tebo on the island of Borneo, archaeologists found the skeleton of a young person who had lived roughly 31,000 years ago. Their lower left leg was missing. Not lost in an accident, not chewed off by an animal. The remaining bone showed a smooth, clean, healed surface that could only have come from a deliberate surgical amputation. Someone had cut through living bone and soft tissue with precision, stopped the bleeding, prevented infection long enough for the wound to close, and kept this person alive afterward. And here's the part that should genuinely stop you. The bone had continued growing and remodeling for years after the amputation. Whoever performed this surgery didn't just save a life in the moment. This person went on living, cared for by their community for 6 to 9 more years. This is currently the oldest confirmed evidence of surgical amputation on Earth, performed 24,000 years earlier than the previous oldest known example. Someone in the Ice Age understood anatomy well enough to remove a limb without killing the patient. Think about what that actually requires: knowing where to cut to avoid catastrophic blood loss, having a tool sharp enough to do it cleanly, and having a way to manage the wound afterward so it didn't simply become fatally infected. That's not luck. That's medical knowledge, tested and passed down. There's a story anthropologist Margaret Mead used to tell that captures why this all matters. She was once asked what she considered the first sign of civilization in an ancient culture. People expected her to say a clay pot or a tool or a weapon. Instead, she said it was a healed broken femur. In the animal kingdom, a broken leg usually means death. You cannot run from danger, you cannot hunt, you cannot reach water. An animal with a broken femur simply doesn't survive long enough for the bone to mend. So a healed femur means something extraordinary happened. Somebody stayed with that injured person. Somebody carried them, fed them, protected them, defended them through the weeks or months it took for that bone to heal. To Mead, that act of caring for someone with nothing to gain from it was the actual starting point of civilization, long before agriculture, long before writing, long before cities. Eventually, this instinct to protect the injured turned into something more deliberate: intentional splinting. Skeletal remains from Neolithic communities have been found with fractures immobilized using bark and sticks tied in place with bandages, essentially the earliest known version of a cast. Somebody had figured out that if you hold a broken bone still while it heals straighter and stronger than if it's left to move freely. That's a genuine medical insight, arrived at through observation and trial and error, long before anyone understood what a bone actually was made of. By the time you reach ancient Egypt, that insight had become an actual practiced skill. In 1903, archaeologists excavating burial sites at Naga ed-Dur uncovered 2 mummified individuals with fractures that had been actively treated. One had a badly broken femur, splinted with 4 wooden boards, each one carefully wrapped in its own linen bandage. The other had a broken forearm, splinted the same way, with a pad of plant fiber pressed into the wound to help stop the bleeding. These weren't accidental preservation. These were deliberate medical interventions performed by someone who understood that a broken bone needed to be held rigid to heal correctly. And the written record backs this up. The Edwin Smith Papyrus, an Egyptian medical text roughly 3,600 years old, describes a technique doctors used to check whether a bone was actually broken. Gently manipulating the injury and feeling for the telltale grinding sensation of broken bone ends moving against each other. It's a clinical technique doctors still conceptually use today when a fracture is suspected. The papyrus also describes treating open wounds with bandages made from honey and oil, which modern science has since confirmed have genuine antibacterial properties. Ancient Egyptian physicians didn't know what bacteria were. They just knew from repeated experience that treating a wound one way kept people alive more often than treating it another way.
And Egypt wasn't the only civilization refining this.
In ancient India, a physician named Sushruta wrote one of the most detailed surgical texts in the ancient world, describing 12 distinct types of fractures and 6 types of joint dislocations, each with its own specific treatment. His texts describe using bamboo for splinting instead of wood, because bamboo flexes slightly instead of staying rigid, which turned out to help bones heal faster and more effectively. That's not a guess. That's generations of careful clinical observation refined into an actual medical system. So, here's the full picture, laid end to end. 45,000 years ago, a Neanderthal missing part of an arm, blind in one eye, and partially deaf lived into old age because the people around him refused to let him die. 31,000 years ago, someone in a cave in Borneo performed a successful leg amputation with stone tools, and the patient lived for years afterward. Ancient communities figured out that a broken bone healed better if you simply held it still and started splinting fractures with bark, sticks, and bandages. Egyptian physicians formalized that instinct into an actual medical practice, complete with wooden splints, antibacterial dressings, and diagnostic techniques. And in India, physicians were classifying fracture types and refining splint materials with a level of precision that wouldn't look out of place in an early medical textbook. None of these people had X-rays. None of them had anesthesia or a real understanding of infection. What they had was observation, patience, and an instinct to protect the injured that apparently goes back further than our own species. Every cast a doctor wraps around a broken arm today is the most recent chapter in a habit that started in a cave, with someone deciding that a person who couldn't walk, couldn't hunt, and couldn't contribute was still worth keeping alive. That instinct is older than agriculture, older than writing, and quite possibly older than humanity itself. If you want to look into any of this further, the research is linked in the description.